The battle of the haves and the have-nots continues. The global health inequality is glaring. The United States plans to start their rollout of booster shots next month. They're targeting those with compromised immune systems. France announced something similar, with their target being the elderly.
Immunocompromised individuals are vulnerable. It is extremely important for us to move to get those individuals their boosters. And we are now working on that and will make that be implemented as quickly as possible.
When we are vaccinated, we develop antibodies. These antibodies allow us to resist the virus, which makes it possible that we don't catch it, or we catch it much less, and we spread it much less, and we almost don't get a serious form of it. And so when we are immunocompromised, or we have certain illnesses, or we are very old and very weak, we lose these much vaunted antibodies. And it is now established that to fight against this virus, we must have boosters. And a third dose will likely be necessary, not for everyone straight away, but in any case for the most vulnerable and the most elderly. This is why we are preparing, like other European countries, to do this third dose for the most elderly and most fragile. And we will do it starting September. So yes, likely a third dose and more for the most elderly and most fragile. At this point, we will take one step at a time.
Vaccine apartheid through hoarding prevails as a thorn in the side of the World Health Organization. Its chief has called for a moratorium on booster shots until the Global South receives adequate doses to protect their own populations.
We need an urgent reversal from the majority of vaccines going to high-income countries to the majority going to low-income countries. Accordingly, WHO is calling for a moratorium on boosters until at least the end of September to enable at least 10% of the population of every country to be vaccinated. To make that happen, we need everyone's cooperation, especially the handful of countries and companies that control the global supply of vaccines.
Another plea to reconsider their intentions and direct vaccines to the Global South.
It's no understatement to say that the course of the pandemic depends on the leadership of the G20 countries. 1 month from now, the G20 health ministers will meet ahead of the G20 summit in October. I call on them to make concrete commitments to support WHO's global vaccination targets. We call on vaccine producers to prioritize COVAX.
The same criticism came from the Africa Center of Disease Director. Dr. John Nkega-Song said the delay in the procurement and administration of vaccines has shifted the herd immunity target goals. More than half of African countries are experiencing a third wave of surging COVID-19 infections. Vaccine hesitancy has dropped dramatically, making the need for speedy rollouts even more urgent. Noma Polani, SABC News.